12:13 here on the TKO show with Kara Rowe. Thanks so much for joining me. It's Bell Let's Talk Day. You've been hearing about it all day. I know Mike and Lisa talking about it yesterday as well. Lynn covering a variety of aspects of it. And joining me right now from Family Services Windsor-Essex, Beth Anne Ternovan. She's the manager of the counseling program and EAP, which is Employee Assistant Program. Beth, welcome to the show.
Thank you very much, Karen. Thank you for this opportunity.
You know, getting a chance to check out everything online, Family Services Windsor-Essex, which is FSWE.ca. We'll go through some of the services that you provide because we always want to bring more awareness. Do people typically seem to come to you and say, oh, I had no idea that we had this available to us?
Sometimes when people approach us, we do hear that. They found out about it through their family doctor. You know, they've Googled us online. They have found out about it from a family member or a friend that has attended our service and remarked to them, I didn't know that that program existed. So in some respects, we do hear those comments, yes.
Because it's funny. It's like anything else. You can see a commercial 100 times, but until it's a need for you, you don't pay attention. Like you don't really know, oh, that exists until you're kind of seeking something like that out. So they may have run across it before, but just it didn't have any impact until now then when somebody needs it.
That's right. And whether it's the individual themselves that's in need of help that's hearing this program today, learning a whole lot more about programs and services in the community through Bell Let's Talk Day, they may be the pivotal person that's helping another family member or a friend or somebody that they know who has indicated to them in confidence maybe that they're struggling with a mental health concern or indeed a mental illness.
Yeah, that's such a great point because I think at times we may hear information and dismiss it because you're like, well, that doesn't apply to me. You know, but there might be someone, you know, in your circle, friends, family, acquaintances that have it's kind of in the back of your head, right? Like, hey, I've heard Joe complaining about that, or Susie's been mentioning this. Maybe she would benefit from it.
Absolutely. Well, you know, and we've heard the data this morning that 1 in 5 of us will experience either a mental illness or a mental health concern in our life and times. It's probably closer to 1 in 4. And so if it's not you that's affected, you're likely going to know somebody in your circle that is struggling with a mental health concern. Absolutely.
So you've been with Family Services for about 20 years. And have you seen the idea change? Have you seen the stigma change over the last couple of decades? Because you have the celebrities coming out now, which always somehow makes things okay, right? It makes things easier to talk about. It makes people step up and say, hey, if it's okay for Beyonce to talk about this, then I don't feel as uncomfortable. How much has that changed in your eyes?
Oh, I've really seen it change dramatically, especially over the last 5 to 10 years. It's much more commonplace that people are talking about mental illness and mental health concerns. It's brought a little bit more of a comfort level in having those conversations. So whether it's celebrities or other people that are taking that courageous step to talk about it, I do think that we've come a long way in terms of reducing stigma. Look at our own community, for example. We just had the 2nd annual Suicide Prevention Awareness Week in Windsor and Essex County in September. And there's a whole lot of other initiatives that are happening in our community with all of our partners, and people are talking about it more. But even beyond that, I feel that people are having greater understanding and greater compassion. They're being more careful, if you will, in watching how they speak about mental health concerns and about mental illness, because you never know who's listening. You never know who has been affected by that or that they're experiencing that with a family member. So I think that we've come a long way. We've still got a lot of work to do, but I think that we have certainly made tremendous steps in the last 5 to 10 years.
Yeah, as you were saying with the Suicide, Awareness and Prevention Week, I find those events so dramatic because I think people suffer alone a little bit because they think they're the only one. They think, well, this is ridiculous if I come out, and talk to someone about this. I don't want anybody to know because you think the incident rate is so small and you're just that small number until you see things like that and you find out how many people are struggling. Then you're like, okay, well, I'm not alone. It is okay to come forward. And that's what I think when the stats come out, that's what amazes me is it gives people the confidence to say, okay, I am not some outcast. I'm actually a part of a greater majority.
Absolutely. We always say participate, don't isolate. And so one of the first steps is being able to share with somebody that I think I'm struggling, I think I may have a mental illness, and ideally approaching somebody that they feel is a trusted confidant that will listen and take their concerns seriously. And that's where all the rest of us in the community come into play, that if somebody does approach you, that we take their concerns seriously, and then we continue to support them, and if possible, that we find out where can we get that person help.
Right. And is there a portion where you have to help the family members as well? I feel like still, if you hear anything about mental health, you get this knee-jerk reaction saying, get over it, or it's not that big a deal, or it's not
Yes.
that serious. I feel like we were trained since we were little, because back then it was brushed aside, or that person was considered weak, and you have to fight through that like initial knee-jerk of how you were trained growing up to, like you said, compassion is so critical nowadays, instead of trying to dismiss someone talking about a mental illness.
I think as a community that we've learned a lot over the last 5 to 10 years about those language stereotypes, whereby we have to be more careful in terms of the language that we're using, so that we are creating an opportunity for people to get help, so they're not feeling ashamed and then more alone, and then they move into a sense of helplessness and hopelessness. That's one of the things that we provide for people at Family Services Windsor-Essex, is that sense of hope. As I was saying, with United Way, we want to hear from you. We want to hear your story. It's not about what is wrong with you. It is about understanding what has happened to you. These people matter in our community, and we're there to help people. And just in terms of that, people, we talked today about where can people go to get help. They can get help through Family Services Windsor-Essex every single day. We're there to help people, not just today and not just during Suicide Prevention Awareness Week. All they have to do is pick up the phone and call our number. Now, while it's a toll-free, it rings into our local office. This is so that people in the county are not incurring a long-distance charge, and so calling 1-888-933-1831. And what would happen is our customer care team, our intake team, will do a brief intake registration with those callers over the phone. We'll find out what the issue is that they're requesting help for. We'll get their demographics. We'll do some safety and security screening questions, because we have to make sure that everybody is safe. We'll determine if they're going to qualify for a subsidy, if they're on a sliding fee scale, if they can use their benefit coverage or their EAP coverage. But if people are just wondering about how our program works, all they have to do is pick up the phone and call. And our caring and compassionate customer care team will be there to assist them.
Okay.
You mentioned our website, Kara. We're going to have another launch, a media launch at the end of February, announcing our new website, and all of the information, the contact information will be right there. But again, just let me reiterate, 1-888-933-1831.
Okay, and so the website is FSWE.ca. And tell me, who can you help for family services? Who should be considering calling you if they are struggling?
Anybody. You mentioned about the family members. If mom or dad are worried about their son or daughter or their children, they can call in and get help from us first, and we'll do some parenting coaching with them. We provide help to individuals, couples, married couples, unmarried couples, family members, children, and youth.
Okay, and that's what's interesting. So it's anyone that feels that they're struggling. Is it depression? Is it anxiety? Is it, just give me an overview of, say, somebody that would call. What would be some of their concerns?
Quite a large continuum. So you don't have to have a mental illness to call us, although we're working with quite a number of people that have a diagnosed mental illness. Some people don't have an awareness or realize quite yet that they might be struggling with a mental illness. But we all face life's challenges. And so we may not necessarily be dealing with a significant mental illness. We might be dealing with a marital concern or a parenting concern or a relationship with an extended family member. We might be dealing with the fact that we want to strengthen our self-esteem. and things of this nature. Again, we all face many of life's challenges, and so we're here to help people across the broad continuum.
It's so interesting. We're going to take a quick break. When we come back, I just want to ask you a little bit about, you have seminars and you have all these great partnerships. So we'll talk a little bit more about that. If you have any questions, you can always hit star 800 on your Rogers and Telus and Bell Mobility, pound 800. You also text 10800. But again, we're talking to Beth Ternovan from Family Services Windsor-Essex. She's the manager of the counseling program and EAP, which is an employee assistance program as well. So we'll continue to talk about this. It's FSWE.ca. It's Kara Rowe on the TKO Show. Welcome back to the TKO Show with Kara Rowe. Thanks so much for joining me. It's Bell Let's Talk Day. So remember, talk, text, tweet, share 5 cents going back to mental health services in Canada from Bell. There's also a video you can watch. You watch it, you share it, and Bell donates. That's right on our Facebook page, The TKO Show. Right now, we're talking to Beth Anne Ternovan from Family Services Windsor-Essex. You can find them online. A lot of great services, counseling and advocacy center. You can find them at 1770 Langlois, 1770 Langlois, and the number to call 1-888-933-1831. That's 1-888-933-1831. And again, Beth, I know you have a lot of great programs there, but you also have a walk-in clinic, satellite offices. Tell me a little bit more about that.
Yes, we're running 5 walk-in counseling clinics in Windsor and Essex County, covering off Windsor and Essex County. Again, the 5 locations, there's 2 running in Windsor every single week, one on Tuesday and one on Friday. We have one that is running out of Erie Shores Healthcare every Monday, another one that is running out of the Harrow Family Health Team on Tuesday evenings, and the 5th one running out of the Kingsville Access County Community Service Office, also on Tuesday evening. We also have 4 satellite offices in the county, including Amherstburg, Essex, Lakeshore, and I always have to look at my notes on this one.
Now,
Leamington.
Oh, okay.
Yes.
Is it okay if I am a spouse, I am a mother, father, I am, someone on the external calling for someone else? Is that possible? Like, can I call you and say, I'm concerned about this. What programs do you have for my daughter, for my spouse, for my, are you able to seek more information that way as well?
Yes, people can call up again. If they're just inquiring about our programs, they're concerned about their children, they're concerned about a spouse, they're concerned about their marriage, and they can talk with our customer care team, who will provide them with the information as to how to access the programs.
And so you mentioned cost. So that does vary, right, depending on the counseling, depending on what type of benefits you have. Tell me a little bit more about that.
Yes, so for people that are on Ontario Works, Ontario Disability Support Plan, or they're considered a low-income wage earner, they will qualify under our United Way subsidy. So our local United Way is supporting us tenfold in the provision of our professional counseling program. Beyond that, we have people that may be using their benefit coverage through their workplace, and that's either through their benefit package or through an employee assistance program that they may have with us. And then finally, we have a sliding fee scale. But again, if one of our callers indicates that a fee is going to be a hardship, with no further questions asked, we'll put them under the subsidy.
And the best way to find out is essentially just call, right, and talk to you?
Once again, to call that 1-888-933-1831, reach our customer care team, and they will provide all the information to them. I'm also happy to say that we don't have a waiting list. Because we run so many walk-in counseling clinics, an individual calling can be seen that week.
That's what I was going to ask you too, like what's kind of a wait time for someone? Because I'm sure some of these issues have a sense of urgency about them.
They can be seen that week. People can access individual counseling with a designated counselor. They can also access our wellness program and a number of our other group programs that we also run. So we run a very robust counseling program with a broad continuum of services in order to address the needs in Windsor and Essex County.
All right. Well, Beth, thank you so much for joining me today. I really appreciate it. Beth Ternovan from Family Services, Windsor-Essex, Manager of Counseling Program and EAP, Employee Assistance Program. For more information, you can look online, FSWE.ca, and find out all about their counseling that they do have there and all the different programs and the cooperation they have throughout the community. And that number, once again, if you have any concerns or maybe you're concerned about someone else and want to find out more about programming, 1-888-933-1831. That's 1-888-933-1831. It's Kara Rowe on the TKO Show.